It's 5 o'clock in Saskatchewan, 7 o'clock later for Rob. So like I said, we're from coast to coast today. So thank you everybody for joining us, and we'll get ready to begin the session. So my name is Stephanie Goslin. I'm the Programs Director with Ovarian Cancer Canada, and I will be your host for this evening's session. And I just wanted to start this session tonight by telling you about an exciting new partnership that we here at Ovarian Cancer Canada have formed with Wellspring Cancer Support. So through this new partnership, we are, like I said, super excited to be expanding our existing support programming. So we are going to be working with Wellspring and really leaning into their experience and their expertise. And we're going to be providing a new peer-to-peer support program, as well as a professionally facilitated support group. We'll have two different groups. One will be a closed 6-week group, and one will be a drop-in monthly group. So those we are hoping to start in probably the next 6 weeks. But if you follow us on social media and watch your inboxes, the registrations will be coming for those in the next 2 weeks. So again, super exciting, these offerings. They'll be available entirely online. So again, from coast to coast, we can all join and connect. And we're also going to be able to offer the programs in both English and in French. So yeah, like I said, keep your eye out for registration. And I also wanted to just now introduce you to Judy Perry-Brinkert. She is the Chief Mission Officer at Wellspring.
Thanks, Stephanie. And thanks to all of you. We really are excited to have the opportunity to be here tonight with all of you. And we're very excited about this new partnership with Ovarian Cancer Canada. For those of you who may not be familiar with Wellspring, we offer a wide range of professionally facilitated support programs for both cancer patients and for their caregivers and those who love them, through both our national virtual center as well as through physical centers in Alberta and Ontario. We're really excited to launch these new programs that Stephanie just mentioned, and to complement and extend the programming that's currently offered through Ovarian Cancer Canada. So I hope you all enjoy the session tonight.
Thanks, Judy. Now it is my pleasure to introduce you to our speakers for this evening. Dr. Rob Rutledge is a radiation oncologist in Halifax, Nova Scotia, and is also an associate professor in the Faculty of Medicine at Dalhousie University. His passion is empowering people affected by cancer, and has delivered hundreds of public talks and webinars, along with over 60 retreats and day-long seminars to thousands of cancer survivors. Rob has received a Cancer Care Nova Scotia Award for Excellence in Patient Care, and Doctors Nova Scotia presented him with a Health Promotion Award in recognition of his contribution to physician health and health promotion in cancer patients. Tonight, we will also hear from Teal Sisters, Terry and Victoria, who will be sharing with us their lived experience. So thank you, and I'm going to pass it over to you, Rob.
Thanks, Stephanie, and congratulations. I've worked with Wellspring for a very long period of time. Ovarian Cancer Canada is a fantastic organization, such great work. And I also just want to take my hat off to each and every one of you for joining tonight, because learning, empowering yourself, getting the information, learning the skills, how to advocate for yourself, it really can make a huge difference in your health. And you can feel less isolated, and you can really, feel better overall. So I'm happy to provide this type of seminar, and just really super happy to be able to work with Wellspring and Ovarian Cancer Canada. So this is the title. It's kind of a two-part presentation tonight. I'm also very happy that we have Victoria and I'm sorry, is it Kelly, who are actually going to share their stories. Terry. There's a huge power in learning from that expertise, that lived wisdom. And I just love that kind of combination. And so I'd highly endorse people joining the support groups and networking and learning and empowering yourself. So hats off to you all. This is what we're covering. It's kind of a two-parter. So I'm going to go over how to get the best care from the medical system, because that's the advocacy part of it. And then we'll have the lived wisdom from Victoria and Terry. And then I'll go over some of the ways that you can empower yourself. There's some recent science in terms of the body part of this. So it's really kind of a fun and empowering talk. And again, we'll have reflections from our experts, the true experts, and then we'll really open this up for the Q&A session at the end. So again, I'm super happy to address whatever questions come up. So the first take-home point is that you really can powerfully influence your physical and mental health, and what I'm advocating is the best of the medical system with empowering yourself levels of body, mind, and spirit. And it's those two together that can really make a difference for you. And I'm going to give you some practical advice and some philosophy about you're the most important person that needs to kind of advocate for your health and get the best care from the medical system. And you do that by preparing, by making sure that you know what your role is, by understanding the system, by asking the questions, for advocating for yourself. And I'll offer some practical advice as to how you might do that as well. And lastly, I'm of the mind that you want to use both sides of your brain. You want to do your research, understand, get as much information as possible. And that's the power of this type of talk, and it's the power of being connected with Wellspring and Ovarian Cancer Canada, is you get this information and you get the knowledge and you figure things out logically, and you figure out what you can have an influence over, what you can't have an influence over. So it's that research part. And then ultimately, I also believe there's something within us that can help guide us towards the next best move in your journey. So it's logic and intuition is really how I think about how to empower yourself. Also just want to reflect that, with an ovarian cancer diagnosis, there can be uncertainty for certain. And yes, a goal can be to maximize your chance of recovery and, maximize your longevity, et cetera, et cetera. And those are super important things. And that's part of what the medical system is doing for you. But a lot of people also want to be able to work with the difficult emotions. And recently I've been thinking about this idea of psychological flexibility, the ability to be a little bit anxious or more anxious and still live a full life and still, do the things that you love to do and so on. So it's very important. And paradoxically, when you kind of let go of trying to feel better, you can actually feel better. The other way to think about this is if you empower your body, body, mind, and spirit, then your brain works better. You think more clearly, you have more energy, you can function better. And that's also a super important goal for everybody who's had a cancer diagnosis. So again, all this empowerment is hopefully fulfilling all these goals for you. So ultimately, you can do more of what you love to do, what's most important to you. And oftentimes we think about, well, then how do I want to spend my energy? I want to connect more deeply with my loved ones. I want to have more meaning in my life as I'm living my life and connecting with other people. So it's getting the best of the medical system and empowering yourself. It's those two together that can hopefully produce these goals for you. Okay, so that's big picture, right? So complete ovarian cancer care. So it's also called integrative oncology, and it starts with understanding. So the information is the empowerment piece. And so you want to understand the medical system, what's outside of the medical system, what you can control, what you can't control. And so having that big perspective, and then you kind of relax into it. I'm doing everything that I can do. I'm advocating for myself in the best way possible. And with that, then you give yourself the best chance of recovery. So understanding that big perspective and why this talk is so important. And then we're going to spend some time about how to get the best care from the medical system. I believe in empowering the body. When your body is healthier, when your body is stronger, better able to tolerate the treatment, you have a better immune function. And so all those things can help with all those goals that we've been talking about so far. Healing at the level of the mind. So working with the feelings of stress and anxiety and practicing a relaxation technique, those things, that the support group element to this in terms of the psychological, normalizing it, recognizing you're not alone in your journey, that you're connected with others. All those are kind of happening at the psychological level that permeate down into the kind of physical healing as well. And then nurturing a spiritual perspective, finding meaning and purpose in your life as you're doing all these other things. You can do it all at once. One of the things that I think is very important during your journey is to keep on remembering what's most important to you. What do you value most? How do you want to spend your energy? We all have a limited amount of energy. And so how do you want to spend that practically? Who do you want to spend that with? Where do you want to invest, in those relationships and so on? So that's important. You keep on coming home and not getting caught up in the unimportant stuff like world news or, political issues or those type of things, unless you're into that stuff. So you ask yourself then, how do you want to be in this world? And in fact, you can take that same philosophy right into the medical system. How do you want to be at the time of that appointment when you're talking to your oncologist or your gynecologist? Do you want to be centered, clear thinking, advocating for yourself? So you're deliberate in how you think and how you act in that particular circumstance. So for me, it's like setting intention, being very clear-minded about not being pulled away by external circumstances and more like, this is how I want to be in this circumstance. And I like to set the intention in a couple of ways. One is as a ritual. So first thing in the morning, I'm doing some mindfulness meditation. So that kind of resets the kind of stress-o-meter in my body. I'm practicing a relaxation technique that's healing for me physically from that perspective. But at the end of that, I'm also opening to, something bigger. I'm like, help guide me. Or from a secular perspective, I say, let me be helpful. Let me be caring. Let me be clear in my teaching and how I manifest as much good as possible, right? So I'm remembering what I value most. I'm trying to set that intention for my day. You can also do that when you go into difficult situations, right? So you're about to meet with your oncologist, you're about to hear a scan result or your blood results, et cetera, et cetera. So going into that difficult circumstance, you remember, okay, this is how I want to be in the situation. So I'm setting my intention going into that. Or maybe it's a difficult family conversation or, presentation at work or whatever is the situation. You can remember this is what is most important to me, and I'm going to bring that into it. And lastly, in the middle of the chaos, in the middle of the kind of suddenly flustered, you're feeling flustered and stressed and so on, is to remember, okay, so how do I want to live my life? What's most important to me in the long term? And oftentimes it's like my relationships with other people. So I don't want to kind of lash out at them, for instance, as an example. So it's the hardest to do, but if you notice when you're feeling stressed and upset, you bring yourself back. You notice that you're stressed up and upset in the midst of a medical appointment. You can try to settle yourself down in that moment and be clear and remember that you're the most important person there and you want to get that best possible care. Okay, so I've been tasked with this idea of talking about the medical system and understanding what's happening and then advocating for yourself. And I really think it's an attitude that you start with. The attitude is that you are the most important person in the room, not your doctor, not your nurse, not their egos. It's like they're there to serve you. And so having that attitude to start out with, and then the skills and the knowledge that I'm going to tell you about will be helpful in doing that. It starts with understanding. So it's really, seeing a bigger perspective, understanding how the medical system works, understanding how to advocate for yourself, understanding what other services are available. Ultimately, you can get better treatment. You can make better decisions. And I think that's really very helpful overall. It's like being able to be in the cockpit of a plane, seeing the plane take off, as opposed to being in the back row when you're rumbling along the runway and you don't know what's going to happen. It's like, no, this is the process. This is how this rolls, and this is how I can advocate for myself. So the understanding piece is super important. We're all individual, right? So I'm going to offer you some different types of advice. We're all in different circumstances. You're working with humans. Your physician, your nurses, your team are humans, and therefore they have their own personalities, and be able to see, what means you can work with that person to make sure you're getting the best possible care, right? So you're trying to read the situation and still advocate for yourself. Different strategies work at different times for different personalities. And if you don't want to empower yourself with a kind of the background and the knowledge, et cetera, then bring in a loved one, bring in a family member or close friend to be your kind of partner who can play that role for you. Again, each personality is different, but you want somebody in the room who understands, who can speak the language of the medical system. And again, I'm saying understand, like get the knowledge, and then, trust your gut as to what you need to do next. Things will change, right? When you're first diagnosed with ovarian cancer, it's like, it can be overwhelming because you're trying to figure out all the options, what's happening, et cetera, et cetera. So there's a lot of kind of information seeking and trying to make the best decision during that time. And things change then, right? Could be end of treatment meltdown. You get through your chemotherapy and then you're sent back home, and then this kind of a psychological overwhelm can happen. And so maybe a different strategy at that particular time. Okay, getting the best care from the medical system. Really, what you're trying to do is to be able to work with the oncologist or the surgeon, gynecologist, whoever is kind of most important in terms of making those physical medicine decisions with you, and to be able to speak their language, to be able to understand your situation, because that physician, so you guys are almost all Canadians, that physician will have attended these international conferences. They'll be tapped into guidelines from the various cancer centers across the country. It's pretty homogeneous, pretty uniform treatment for the most part, kind of the first line therapies across the country. But your physician needs to interpret your situation for you. So in some sense, you're getting yourself prepared for that conversation, and kind of the nuances of the pros and cons of each option. Sometimes, you need to have surgery. That's the only option for you, but at least you're understanding and then getting that advice from that individual. So we prepare for those conversations by doing the research and understanding the language of the medical system even before you kind of get into those appointments. Information is very powerful, right? And if you don't want to learn that language, then you want to have that family member, friend play that role so they can really interpret for you. That when you understand, then it's obviously increases your sense of well-being. I think it helps you make better decisions. And there can be a spectrum between you say, doc, you do whatever you think is best, to you seeing the doctor as a consultant and you kind of choosing your options. But either way, when you understand, and that besides, the physicians will respect you more if you're asking those good questions, if you're listening, if you're prepared, you have your questions ready, you have all that stuff, they will take you more seriously. That shouldn't affect the decisions being made, but you get a better conversation from them. And then obviously I'm also advocating for the kind of non-medical ways to empower yourself. And we'll go over that in the second phase of this talk tonight. You can take this too far, like everything else. If you're getting too much information, especially if you find that you're getting conflicting information, you're reading one site, you're hearing stories from this person, you're going into the studies and the side, and just it's not making sense and it's feeling conflicting, then really you're probably going too far. And what I would recommend is, again, get back to your physician, make that phone call, get the clarification of the issues, because the physician's job is to make sure you understand what the pros and cons are of each action. And again, they're individualizing the care for you. So if you're getting conflicting information, it's making you feel stressed, that's not a good space to be in. You want to learn the language, not teach the course, so to speak. So trust that you are doing the best that you can. So at some point in time, we have to let go of trying to control everything and have a bit more tolerance for the kind of unknown of what's going to happen in the future. Because if you're always trying to control that, then that can be very tiring. So obviously Ovarian Cancer Canada is a great source of information. Canadian Cancer Society also offers an information service for all types of cancer. They have the contact information there. You can find these not-for-profit websites. I would stay away from, the private institutions are trying to sell you some type of product in terms of the information. So the not-for-profits is the best way. It's less so these days, but you can actually go to the librarian or information specialist at the cancer center or hospital. You can ask about whether there's a person there who can help you with your searches. Okay, how to get the most from your healthcare. So you're learning to advocate for yourself by preparing, going into the doctor's visit, knowing what you want to get out of it. Secondly, so sometimes the information, there's a lot of information that's happening at that appointment. You may not be able to absorb it all, and especially normal because it's stressful to go into an appointment like that. And so you may go home and, 2-3 days later, again, not quite sure that you've got it exactly right. This is where the advocacy piece is so important. So you reach out, you make those phone calls, you're the squeaky wheel that says, I'm not quite sure about that. Can you call me back? And sometimes it's the nurse who has 95+% of the information, can call you and clarify. Sometimes it's the physician that needs to call you back and, answer those questions so you can be clear about what's happening. I'm going to talk about drawing on some extra services within the medical system. And we'll also talk about how to ask for a second opinion if need be. So flushing this out now before the visit, understand your story clearly. That's part of your responsibility, right? Is to have your symptoms, your story down, bring in a current list of medications and allergies. I happen to like this idea of having a folder with all your medical information in it, because sometimes the medical system, misplaces that information. It's much easier for you just to be able to say, well, actually, here's my blood work from 2 days ago. This is the answer. So it's one strategy that I like to have. I highly recommend that you and the person with you write down your questions beforehand. I'll give you one other kind of quick advice around this one. So typically what happens is you'll go into the appointment, the physician will ask you a number of questions, make sure you have he or she has all that information. They'll examine you, and then typically they will go through a summary of what's happening and the plans for the future. Typically in that kind of summary, they'll probably answer the majority of your questions. So you don't want to kind of come in, firing questions. Wait till the summary's done and then say, can I ask a few more questions? Then look at your list, figure out which questions haven't been answered and ask those extra questions. And obviously, I believe every time you go to a medical appointment, you should be accompanied by somebody. Bring in that loved one or friend, the expert. Decide who is going to record the visit, get down the information. So they may be the scribe, you may be the person answering as they're asking the questions. The other thing you can do is just be very blunt with your physician and say, can I please record the summary of this visit, right? So the idea is that way you can kind of play that tape back afterwards, play it back afterwards. So, and as I said before, I think creating a file with your test results, just keeps everything in order, having a little summary ready to go. And you have the right to a copy of your medical record. They may charge you like $50 to photocopy it, but you can go in and say, go into medical record and say, I want a copy of everything about me. That's your legal right to that. So your blood tests, your x-rays, your operative reports, pathology reports, clinic visits, it can all come out in a single document. When you're there in person, I'm of the opinion that it's best just to be open and honest with exactly what's happening and asking those tough questions if you're the type of person that wants to do that. So the more they understand you, the more that you're open and honest, the easier it is for them, your physician and nurse, to be able to work with you. So I like that idea. Secondly, just be mindful that some physicians speak in complicated language, so they're speaking, medicalese. And if you hear that and you don't understand what they're saying, then and you're feeling overwhelmed, then I would kind of stop them and say, "Sorry, doc, I'm not quite sure what you're saying. Can you use some simpler language to explain this?" So again, because you're the most important person in the room, you want to kind of press the pause button, get them to repeat something that makes more sense in this situation. And as I said before, usually you can wait till the summary, then you ask your questions. Don't leave until your questions are answered. Again, you're the most important person in the room. You have that presence. You want the great care, and take notes or record the interview. Lastly, and this is really important, this is your responsibility now, know what to look for. Like if you're going to start a medication, what are the side effects? How bad does it have to be before I do something? And what do I need to do? Who do I call at 3 a.m. if I run into a really bad side effect from this, right? So you're understanding that it's not just them giving you something. You have to watch for side effects and respond appropriately. After the doctor's visit, I still, again, keep your journal and the list of results. Sometimes, everybody and their dog wants to hear about what's happened and what the choices are, et cetera, et cetera. And instead of you being the conduit, or the person that went with you being the conduit, you can bring those extra members in for the consultation. Again, COVID is a little restrictive on that side, or you can do like a Zoom call or that type of thing to get multiple people to hear what's happening if that's what you want. You are the most important person in the room. Just remember that, stick with that. Sometimes there can be a disconnection between you and your physician, right? The personalities can clash a little bit. It's possible for that family member or your loved one to ask more of the questions, so there's kind of less of a feeling of conflict there. And again, keep on calling, keep on asking. If you're not understanding what's happening, ask for a phone call, ask for another appointment. Yes, the medical system is a bit stressed right now. That doesn't stop you from advocating for yourself and making sure that your questions are answered. At minimum, you should be getting a phone call and having those questions answered. Okay, around this issue of second opinion. So you are entitled to a second opinion, and I would do that if you don't trust your physician, you really feel like you're not getting optimal care, or there's been some real breakdown in communication. So those are probably the two situations where this is not working out and you should go on to the next person. The way to do it, so the nurse who works with the physician can help make that referral to another physician, or your family doctor can also put in a referral as well. So you worry that somehow you're going to insult the first clinician. Well, all oncologists have had the same situation happening. And really, again, you're the most important person, and you're going to want, to get to that second person if you really feel strongly about it. Should it be in the same center or a different center? I actually think that, within Canada, because the care is pretty homogeneous, you can, if it's a personality issue, talking to that second oncologist is a good way to go at it. They're tapping into the same guidelines, the same international data, the same trials. So they should be giving similar physical care decisions. If you really think it's a rare circumstance, you can just ask directly, to your oncologist, does it make sense for me to get a second opinion from a different center, within Canada or within the States? What do you think? Is it worth that extra effort? And again, if your oncologist really cares about you and really wants you to be happy and well, then they will help facilitate that. Again, I wouldn't worry about the oncologist being insulted and then therefore them kind of withdrawing treatment from you. They will continue to treat you in the best way that they think is best for your situation. So I just think it's better for you to be happier with this issue of a second opinion and get that if you really feel strongly about it. But really, if you're going to the same center, it's unlikely there's going to be a big change in terms of the physical care that they're offering. And the last bit of advice is that there's a lot of other services within the medical system. And oftentimes you have to speak up for that because, frankly, as an oncologist, I forget that there's all these other experts that are there. And especially, for instance, a nutritionist, you're forced into a low fiber diet. There are some good low fiber diets that are healthy, et cetera, et cetera. 1 in 3 people out of ovarian cancer. Other cancers have, significant anxiety, depression around that. So I always say, go to an expert, the psychologist, the social worker. There's rehab, there's palliative care, there's spiritual care. There's lots of other folks that can help facilitate that great care for you. And how you do that, you ask your nurse or doctor. I'd always say, talk to an expert. So I think that summarizes the this part of the medical system, and recognizing that you really can make a difference in the quality of care that you're receiving by being prepared and advocating for yourself, and looking for those opportunities to really help facilitate all that healing. So I'll stop there and pass it on to Victoria and Terry.
Thanks, Rob. Some great advice there. And I know we're going to hear now from Terry and Victoria. And having spoken with Terry before, I know she keeps excellent notes. So I'm sure she'll tell us a little bit about that. Terry is 56 years old, and she has been married to the love of her life for 34 years. She has 3 adult sons, 2 lovely daughters-in-law, as well as 2 grandsons. Terry is also a nurse by profession and loves being outdoors. Reading, cycling, and kayaking are among her favorite activities. Victoria, both are from Winnipeg, I should mention. Victoria is 42. She's married with 2 teenage daughters and has an amazing and supportive husband. She has worked in management for 8 years and is now enjoying taking a break. She loves to read, crochet, scrapbook, and play video games. Or I'm sure your 2 teenage daughters love that, Victoria.
They
Her
sure
daughter,
do.
yeah, her dog and 2 cats are always within a few feet of her, no matter what she's doing. So welcome, both of you. Thank you for sharing your experiences with us. And Victoria, I'm going to pass it over to you.
Awesome. So thank you so much for having me. I really appreciate the opportunity to come and speak, and I'll talk a little bit about my experience in advocacy. It's definitely been a learning process for me. So when I first started to experience gynae symptoms was about 10 years ago. I wasn't even 30, I don't think, at the time. And I was sent to an OB/GYN, and we had some tests, and they determined at that point that I had endometriosis as well as ovarian cysts. And the OB/GYN to me stated that I should be reviewed every 6 months or so, because I was, taking an immune suppressant drug. Surgery was not an option for me at that time, even though I had requested it. I said, well, what about a hysterectomy? The doctor said no, and also insisted that I might change my mind and want more children, which I found, I didn't know how to advocate for myself yet at that point. So it was certainly challenging. I do feel like as women, and as young people, we can have trouble advocating for ourselves, and we're often so busy caring for those of us around us that we forget to put ourselves first. We don't want to be seen as pushy. We don't want to be seen as assertive. That can make things difficult. I know for me, I had a big fear that there would be some kind of negative note put in my file and that a doctor would treat me differently. And so I was afraid to fight for myself and to put myself first. And I had to learn that lesson of how to do that in a polite and friendly manner in order to get the results that I wanted and in order to leave the appointments feeling satisfied. So when my results came back, and I was told to see, investigate these cysts twice per year, I was in the process of moving cities. And I was moving to Vancouver at the time, and I got a new family doctor reasonably quickly, but the doctor was not as proactive as I wanted him to be. He didn't seem to be bothered by checking twice a year. He didn't want to follow this advice. He said I didn't need it, that I was young and that it was healthy and that it was not concerning. However, 5 years later was when I started to experience what would eventually be ovarian cancer symptoms. So I had irregular, very heavy bleeding and bloating, and I had to ask 5 times over a period of a couple of years to see an OB/GYN. He just kept telling me that I didn't need it, that it could be perimenopause, that he wasn't interested in investigating it at all. And I didn't know how to ask. I didn't know how to be assertive. So eventually I was seen by an OB/GYN. He also really was not, he wasn't as proactive as I wanted him to be with my situation. I should have learned to ask more questions. I should have learned to do the research. He did do a pap smear, he did some blood work, he did an ultrasound, but he never actually informed me of those results. And I think we get very conditioned to, no news is good news, but that's not really okay either. I think that we should be given results, whether they're positive or negative. And sometimes that means that we need to, in a stressed out medical system, take charge of that and ask for those results. So 5 weeks after my doctor had called me to tell me that those cancer tests were negative, my cancer was diagnosed, and it was diagnosed at stage 3C or 4. We're not totally sure. High-grade serous ovarian carcinoma. I am now in a state of recurrence. I did 9 rounds of chemo, slowly, figuring it all out. But I've really learned in this journey how to be my biggest advocate and how to put myself first. So, like all of the advice that Dr. Rutledge gave, I bring a notebook to each appointment, I write notes, I record the answers to every question that I have. I write a list of questions ahead of time. I don't hang up the phone. I won't leave the office until the questions are answered. And I've never been met with any problem in that regard. Something else that I do, I paraphrase the answers back to the doctor so that I know that I understand, they can hear me providing that answer, and we can, confirm clarity between the two of us. When a treatment is declined, and we all hear advice from others or see things on the internet that, might be alternative treatments or different tests or things that we might be able to do. When they're declined, I want to know why. It's really good peace of mind for me to go home and know that I did my best and that I tried my best and that I understand when something can't be granted to me, why that's happening, or why the opportunities might be different for me than for someone else that I might be talking to with ovarian cancer as well. I also ask that if a request is denied, that it's notated in my chart. And then there's a record of my request. I have had doctors change their minds and agree to do a certain test or a procedure as soon as they're asked to make that note. So there's nothing wrong with asking for those things. There's also nothing wrong with asking for your own test results. I do keep a folder, just like Dr. Rutledge has recommended, of all of my blood work, all of my test results. I have a disc with my CTs and things on it. There's never a bad time to be a proactive member of your own healthcare team and know that you're getting the best results. And then lastly, this one took me the longest, knowing that it was okay to put myself first. I was entitled to the best outcome of any situation, even if that's, a tiny scrape or a huge, hysterectomy surgery. I was entitled to the best outcome. I am entitled to be comfortable. I am entitled to be symptom-free. And it's never too small a request if it makes you feel better. So learning to put myself first has been a really, really big deal for me. And so that's all I brought with you today. But that's a bit of my experience there.
Thanks, Victoria, for sharing. I know you've had quite the journey, and I appreciate you sharing some of those things that you've learned. In particular, I love the advice that you gave about confirming and really getting clarity. So paraphrasing what the doctor has said and just making sure that you really understand what he's saying. So excellent advice. Terry, I'll pass it over to you.
Hi, thank you, Stephanie. Thank you for having me today. I really appreciate being able to be here as well. So my story started with a routine doctor's appointment where I mentioned that I was having some vague, infrequent, mild low back aches and a heavy feeling in my pelvis. Very PMS-like, but since I was postmenopausal, I didn't know what it was. I thought it might have been endometriosis. I did ask my GP for an ultrasound, and he did order one. That ultrasound showed that I had a complex ovarian cyst, and I was told that it was not concerning for cancer, which was a huge relief. I was referred to a gynecologist as well, and she was not at all concerned about the complex cyst, as lots of people seem to have such things, and they're usually benign. So my follow-up ultrasound should have been at 3 months, but it turned out that probably due to COVID, it was actually 9 months later. Looking back, I realize now that I should have been on the phone with my doctor's office, asking them to look into it and to advocate to make sure that it happened in a family in a timely manner. But at the time, I really didn't know to do that. And I really didn't know that it was important. I mean, I'd had that not concerning for cancer kind of ringing in my ears. My 9-month follow-up showed that there were changes that were concerning to cancer. and an urgent MRI showed that I had a tumor that was already spreading in my pelvis. I did have a successful surgery with good debulking, and that revealed a mixed endometrioid and clear cell tumor, stage 3B. I had my 6 rounds of chemo. At my 3-month checkup, I had some mild low backaches and a CT scan, which showed no evidence of disease. So my dance with Ned was in progress. At 6-month checkup, I felt great and was granted permission to go back to work. My work put me actually into a rehabilitation program, at a gym, which was fantastic for helping me get stronger and really physically prepared to be able to do my job. Just before I was actually back at work, my 9-month checkup, I had some very mild changes in bowel habits. This was one of the things that the doctors gave me a list of things to watch for. And the doctor ordered another CT scan, which showed that I was in a recurrence. Because my cell types are a little less common, the treatment choices for me are different. I restarted chemo in August, and I'm getting the same type of chemo that I had originally, and I've had 2 cycles now. I'll have another CT scan after my 3rd cycle, and then we'll kind of go from there. So some of the things that I do to advocate for myself, I keep a health diary, just as Dr. Rutledge recommended and Victoria said. I have a page to record just at a spot, important dates, my surgery, dates of scans, dates of procedures I have, those kinds of things. It's very easily accessible to me, and it's much more effective than scrolling through my calendar on my phone to try and figure out exactly when that port was put in or whatever. I do keep a list of all the symptoms that I have, just on a little note on my phone. Anything I've been told to watch for. If there's something urgent, I can call my health team right away, or I can wait and watch and bring it up at my next appointment. I write it down because it helps me to remember accurately. Did I have this twice? Was it a week? Was it a month? I can't always remember, so it helps a lot. I also write down questions as they come to me, not necessarily just before my appointment, but at any time if I think of something, I always have my phone. Most people have their phone nearby. I just write it down. Then before each doctor appointment, I do prepare. I review my symptom list and my list of questions. I may talk to my husband or other family members, see if they have any questions to come up. And then during the appointment, I write some brief notes. I just scribble them down on a piece of paper so that I can kind of have my answers listed. I don't either say goodbye until I'm satisfied that I have my answers, my questions answered. If I don't understand something, I ask for an explanation. I do feel like it's my job to ask and to be sure that I understand before I leave. If I later realize something's confusing, I don't remember, and I want answers, then I call back to my nurse and she facilitates what I need to have done. That has helped a lot. So then shortly after the appointment, while my memory is still fresh, I actually rewrite my questions and my answers in a legible, as complete format as I want in my health diary, so that when I look back, I know who I spoke to, I know the date, I know what questions were asked and what their answers were. If I hear of a treatment that has not been offered to me, or if I hear of something that might actually help some of my symptoms, I ask my healthcare team. They can explain why it may or may not be appropriate for me, and they can help me understand what the best options are. I do find it helpful to have a copy of my scans and my blood work, so I ask for that, and I keep them in a binder, and so I've got everything in there. And now I also know to keep track of things like my scans and dates when they're scheduled, and to make sure that if I don't end up getting something happening around the time that they thought it would, then I can follow up and make sure that that happens. So there you go.
Great. Thank you, Terry. Man, oh man, you are super organized. I love that. I particularly loved when you said you plan for your appointments. It's almost like a meeting, right? You take some time and you plan for it. And I love that you ask your family member also if they have questions, right? We can't forget about the huge support team and that they can come with you. Really great advice there. Thank you so much, Terry. Dr. Rutledge, I'm going to pass it back over to you, and you're going to walk us through some self-care tips and tricks.
Great. Yeah. Thank you so much, Victoria and Terry. Like I learned a lot just from the commentaries. So I'm going to integrate some of your excellent points into my next talk. So this is what happens when you connect with Ovarian Cancer Canada or Wellspring. You start learning the tricks of the trade, how to do this. And I guess we're all saying, make sure that you get the reports from your scans and your blood work. And I just love Terry's suggestion, if you're booked for that CAT scan in 3 months' time, make sure that that gets done. Right. So, you advocate for yourself. Even with COVID, you're like so important in this situation. Keep on advocating. So thanks, guys. Really, really appreciate the great expertise and sharing. So big picture, if you know it's good in preventing your type of cancer, you want to do that thing after a diagnosis. So if you know if exercise is good in preventing ovarian cancer, you want to exercise afterwards. If something is causative in your situations, like for instance, smoking, then you want to quit those things. You don't want to let any slow growing cells that may be in your body get more and more aggressive with time, get more fast growing. So this is all motherhood stuff. So I'm not going to spend a whole bunch of time going through all the kind of science behind that. And there is increasing science around that. Just to say that it doesn't have to be exercise, it can be physical activity, it can be movement, 10-minute segments at a time. People who do that simply have more energy, better function, they sleep better, it releases the happy hormone. So it's one way to kind of reverse engineer how your brain is actually working. You're better able to tolerate chemotherapy, you'll be stronger, better immune function, less inflammation in the body, which is really important as well. So that's you need to do something, even if you're tired, even if you're in the bed most of the day, doing something is actually better than doing less. How do you do it? How do you get into the routine of moving your body, having that activity? And so make it fun, make it social, create a routine so that every morning when I get up, I'm going to do this particular thing. And at the same time, I say do the work because you're sending that really strong message to yourself about, I want to get better, I want to survive, I want to recover, I want to heal. That's what you're doing when you're proactive in doing something to get your heart rate up and a little sweat on the brow. I wanted to update you around the science of what they call sedentarism, because this is something also you can control as well. So it's essentially sitting too much. When you're sitting, reclining, and lying posture during the waking hours. And we are all at risk of that, right? Because the TV and the Netflix and video games, I heard, was one of them. We're on our smartphones. We often commute. So it's part of the culture right now to be sitting a lot. And so you just think about how many hours you're sitting and sitting at a time, right? Because if you sit for an hour and then you do something, that doesn't really count. But too much sitting in a row, definitely if it's more than 3 hours, is really bad for health, even 6 hours worse. And it's not taking a break, not kind of moving your body. The takeaway is for each of us that we should be up as we're able for at least 5 minutes every hour of sitting, getting onto your feet, stretching, doing something. And the reason being is that the data is strong, and I'm not going to kind of quote all of this data here, but just to say increased all-cause mortality, probably because it changes the fats and sugars and puts us at risk of diabetes, obesity, heart problems, increased risk of cancer. And again, if it causes or puts you at increased risk of this problem, then you not want to do it afterwards. Even adjusting for physical activity. So even if you're doing your 30 minutes of the recommended exercise, 6 days a week, you're going to lose all the benefits if you're watching TV for 3-4 hours in a row. Just get up 5 minutes, transition time. So heart disease, diabetes, all increased risk. Little interesting quotes from British Journal. 6 hours in a row takes You do that every day, 4.8 years off your life, or you convert that to 21.8 minutes compared with a cigarette. So again, something that you can control, stretch, get up, do something different. How do you do it? So we have these little technology pieces, those little watches or cell phones that can set a little alarm every hour to get us up. But stand at every opportunity. And we are going to stand up here in a moment. So for instance, I have the ritual of whenever I'm talking on the phone, I will actually get up and talk to that person while I'm standing. So it kind of breaks up my day that way. Look for those opportunities to walk up the stairs, a flight of stairs, or walk to work. The other one is a stand-up desk, right? So while you're doing your emails, you can actually be standing. Yes, you don't have to stand permanently. If you can kind of go up and down, it works out as well. So don't sit too much is the takeaway. It's a very important health habit, number one. Okay, so just while we're there, if you can just stand up on the spot, or if you're watching this kind of video afterwards, kind of stretch and reach up towards the sky. And just on the spot, stretch whatever needs to be stretched within your body. And lastly, just a little rub on the tummy, maybe a rub on the heart, a little self-soothing, a little oxytocin, right, as we're looking up and away from the computer. Okay, so that was very short. It wasn't the full 5 minutes, but it gives you the idea that you can do things. I like it. I like to break it up. For instance, when I'm having to do emails for an hour, then I will go, stand up and wash the dishes before I, go on to that next activity. So I'm kind of breaking up my day by different activities. Again, motherhood stuff around nutrition. And I just want to give you the quick principles of this as well. I would always say, talk to an expert, go see the nutritionist, make sure that what you're doing is good with your oncologist and so on, especially ovarian cancer, because, there can be some bowel upsets, there can be some weight loss, weight gain. You can run into diarrhea, constipation, sometimes ask for a low fiber diet. Those are all things that you can, can be mitigated by changing your diet to a way that's good for you. I'd say change the soup. So it's the idea that there are chemicals around the cells that drive the cell growth, and that inflammation or irritation within the body can cause further damage to the cells, which can make them more aggressive. And even the inflammation can kind of prime the cells to keep on growing faster. So we want less inflammation. So overall, we're choosing an anti-inflammatory diet. Or lifestyle, I should say, between diet, exercise is anti-inflammatory, practicing a relaxation technique, getting a better night's sleep. These things all contribute to kind of setting down this irritation that's within the system itself. Just touch briefly on the microbiome. It's the 100 trillion friends that are your bacteria in your gut, this whole ecosystem, super important in all aspects of like digesting your food, getting the food into your system, boost immune function, hormone function, serotonin, for instance, there. And the problem is if you have a diet in processed foods or refined foods, it can really irritate the gut, change the bacteria, irritate the lining of the gut, which causes leaky gut syndrome. So you really want to be kind to your gut and kind to your 100 trillion friends. You need to feed them fiber is part of it as well. So fiber, some probiotics, you're like actually ingesting bacteria. That's okay, but it's only 20 to 30 species. It's not that important. It's important not to, maintain or take those probiotics for too long, or the same ones for too long. So fiber, I think is probably the more important one there. So how is it that diet can help cancer patients, help that situation? So we don't want the slow growing cells to turn into fast growing cells. And so we have antioxidants. So the fruits and vegetables have these molecules that mop up the damaging or the stimulating chemicals. So that's one way it kind of mops up the damaging part of this. Turns off the signals for cell growth. So when we drink a can of juice full of sugar, that can really spike our blood sugar, and that releases insulin to try to get the sugar back into the cells. And with that, the insulin has other growth factors that actually prime cell growth. So again, A low glycemic diet where your glucose levels are not spiking up and down is a much healthier option. And ultimately, you want to kind of change the soup, right? Get the healthy soup, get the immune function. It's going, you have an innate capacity to help yourself heal if you can kind of support the whole system there. Dietary advice, big picture, variety is so important. Micronutrients, nutrient-dense foods from multiple food groups in each meal. I'd say try to really pump up more on the veggie side, the fruit side, the plant-based side, the needs and so the beans and nuts and legumes. Really try to avoid the red meats and the processed meats. So really down less alcohol, no sugary drinks, avoiding the processed foods. They're the healthy fats. This is a whole talk by itself. And then there are these other very healthy, non-processed foods that can really kind of feed your gut, feed your bacteria, and feed the cells within your body. And lots of different options now within the grocery stores. Everybody should be on vitamin D within Canada for 10 plus months per year. It's a one supplement, and really that we need to enjoy eating. So big four food groups. You can probably get your doctor to do a vitamin D level. So that's your family doctor to make sure you're getting enough vitamin D in your system. There's my vitamin D habits. First thing in the morning, I'll reach out for my B12 and my vitamin D as I'm reaching for my toothbrush, and celebrate that. Shopping, plan ahead, read the labels, eat food, mostly plants, not too much. Don't buy the unhealthy stuff. It's really hard to eat it at 10:30 at night if it's not in your cupboard. Read the labels, right? So, eat food, not chemicals. And this is a label from the oatmeal that I eat in the mornings, right? So you can see that their real food is in there. You want to be efficient. I like these see-through containers. It's very easy and quick to go to the fridge. There's something healthy you can have as a snack on the spot. And so you're doing that efficiently, pre-chopped veggies, for instance. Frozen foods are a great option as well. If they're frozen at time of the picking, they don't lose their nutrients. I happen to like frozen blueberries as a really good option. So really some easy recipes on that side. And lots more here, right? So the cauliflower crust pizza, the beans, the peas, the cruciferous vegetables, spinach, like there's a lot of stuff that you can have in your freezer that can be converted to a quicker meal and a really healthy meal on the spot. Tips to making this work. I wouldn't expect people to just kind of change their diet, transform it overnight. It's harder to do. What I'd say is keep on experimenting, keep on learning as to what meals, preparation techniques work for you in your life. You're slowly transforming your diet over the months to really help yourself on that side. I'd say, focus on the plant-based foods. It can be the seeds and nuts as well. 50+% of your plate is in the veggie side, and just don't buy the unhealthy stuff. Well, I can talk about the healthy swaps. That'll be it for another day. Last two things, maintaining a reasonable weight. I'd say fitness trumps fatness. Don't look at the scale. That's not important. What's more important is that you energize your body through exercise, you energize your body through a good diet, and let the weight figure it out itself. So we're not going to kind of focus on that. We're going to focus on the things that you can control, which is your fitness level, which is way more important, if you can, if that works out for you. And lastly, I'm just going to offer you a little bit of the sleep science. It's now called Healthy Sleep Habits. Has a profound influence on your health. So big picture, if we can decrease our stress level and anxiety levels overall, generally speaking, then we can sleep better. And so again, exercise, practicing a relaxation technique, reframing, such great attitudes between Victoria and Terry about, living their lives more fully. Sleep hygiene, you can train your brain to get a better night's sleep. So you're creating conditions in which this is more likely to happen. So that's the idea. And the first thing is to have a routine every night. Your body gets better at going to sleep at the same time. Same activities. I like to turn down the lights, lock the doors, tuck in my wife. It's like same thing, read a little bit of a book. my brain gets habituated to feeling sleepy at the time if I'm doing that at the same time every night. You can set a lights out alarm. So for instance, if I want to turn the lights out at 10 o'clock, I put my lights out alarm for 9:45 so I can go through that routine I just described. Another idea is you can write down your worries and your plans in a book. You write those down, and then you close the book and you set it aside and you tell yourself, look, it's going to be there tomorrow. I don't have to worry about that tonight. Try to get up at the same time, that 7, 8, 9 hours later, whatever's best for you, but you're getting up at the same time, so it really becomes a routine. Big picture, try to avoid the stimulants, especially screen time, for the 1 to 2 hours before. And that blue light is kind of stimulating your brain and can stop you from having sleep. Exercising too heavily a couple hours beforehand, or a super heavy meal. The other run around diet is time restricted eating. Trying to not eat for 12, 13 hours at a time is really very healthy. The other stimulant is caffeine. Try to drink your caffeine early in the day, not late in the day. So, if you're drinking a quarter of a cup of coffee at 10 p.m. at night, that's the same thing as drinking that same cup of coffee at noon, because it's a full cup of coffee at noon, because that caffeine is still in your system. Sleeping pills, alcohol, yes, they can help you maybe fall asleep, but it just disrupts getting the restorative sleep, the deep sleep and the REM sleep. So I don't recommend using either of those to actually improve your sleep, because they don't help. Obviously, you mimic the light in your house by dimming those lights as you go by. You can use blue light blocking glasses. So for instance, if you are forced into doing emails later on, last couple hours, but not the overhead lighting that mimics the sun at that point. And then staying in the dark at night, I happen to use eye shades that allow my brain, especially in the summertime when the sun's coming in too early. And then first thing in the morning, when you first wake up, try to get to the natural light. So even looking out the window first thing that morning for 30 minutes gives you the kind of higher intensity of light that mimics the light, and it sets the clock. So 12 hours later, you start to feel more tired. Yes, there's ideal room conditions, dark, cool, safe. Cool, because your body actually drops 1 or 2 degrees Celsius. Your core temperature actually goes down. So you want to keep that cool in order to get a better night's sleep there. If you're waking up in the middle of the night for more than 20 minutes, the science says you should go to a different room so you don't associate your bed with wakefulness, and then you return to your room when you're feeling sleepy. I would say do a more relaxing activity when you go to that next room, like a relaxation technique or reading a book, but not the stimulating film, for instance. Or think of a peaceful activity is another idea around that one. There's a whole treatment around insomnia. Again, this is a whole other talk around what you can do if you're having chronic problems of not sleeping at night. And so there's experts around that. And again, I'm giving you the shorter version, but you can continue to research and understand what is helpful for you. Melatonin, I would really say only use that if you're changing time zones, if you're flying and so on, suffering from jet lag. Otherwise, it shouldn't be used chronically, and it should be used at this lower dose that I've quoted there. I believe that naps are good because the science shows that after napping, you have better concentration. You can learn in different ways more easily. The mood bursts up, improves. Your blood pressure can go down. But the point is not to nap too late. So it's definitely, before 2 p.m. or even like 4 p.m., 15 to 20 minutes, I think enough to get into REM is really restorative for you. So napping, I think, is good. And overall, don't get too wound up about if you're having insomnia. It's just getting stressed about whether you're sleeping well enough or not is not helpful. What you really want to do is just be really kind to yourself, really loving to yourself. You do everything that you can in terms of setting up the conditions, and then just peaceful with the process. And it can take time to learn how to promote a better night's sleep. Okay. Lastly, I'd say in terms of physical habits that can really make a difference in your health is practicing a relaxation technique. So it's not like just going for a walk or, having a good bath, which they're both very nice, but actually practicing a technique where you're settling down the stress levels, you're bringing your attention, to the exercise, letting go of this disruptive thoughts and so on. So actually practicing there. So mindfulness, you can use meditation, you use body scan or visualization. There's lots of good stuff on the internet. There's Qigong. I would get you up for some Qigong as well. Tai Chi, some movement while you're practicing this. And the data, again, is very clear that you can change the neurocircuitry within your brain. And, it has health effects, both physically and like a mental health effect. It's you actually feel better by practicing relaxation. Being in that more positive, centered, clear thinking state of mind is something that we can all work towards and practice. And I wish that for each and every one of you. Oops, I think that's it. I'm going to stop the presentation right there. And just a quick plug of our program coming up, Cancer PEP, which I'll just explain later on. So back to you, Stephanie.
Great, thank you, Rob. There was some great advice there too. And I know Judy, as you were kind of going along, some of the programs that Wellspring offers coordinate very nicely with some of the things you were saying. So make sure to check out the chat box there. Judy's put some great suggestions in there also. Now I'm going to turn it over to Terry and Victoria again to give us some of their tips. And I know number one, I think on both of their lists is physical activity. So I'm going to pass it over. Terry, do you want to start today or now?
Sure, I'm happy to do that. Maybe not number one on my list, but physical activity is certainly on my list. So my number one thing actually is keeping hope alive every single day. I believe that this is the most important thing that I can do for my health and also for my determination to live well and to achieve another round of Dancing with Ned. And there are actually lots of ways that we can do this. I try really hard not to dwell on statistics. I know that all of us have searched the internet, but I am not a statistic. So I do not live my life as if every negative statistic is me, because it's not. There's no reason why I can't be one of those who lives well, even with recurrent disease. Being diagnosed with ovarian cancer has taught me to be intentional about how I live. For me, that is important that I stay actively involved with people. I intentionally spend time with my family, and I love spending time with my grandsons. My faith is the basis of my hope, and I spend time at church activities and with friends. I try to schedule the right amount according to what I need and how I feel with my fatigue and whatnot. I feel that I need to acknowledge the loss of my health and the feelings that are involved in that. Not everyone understands this. I have found that the Teal Teas that Ovarian Cancer Canada sponsors have been a very, very helpful way to be, for me to be a support to others and also to be supported by others. They understand the types of things that we go through, as well as the feelings about those things, our hopes, our fears. Sharing with the group has been very helpful to me, and it's also satisfying to help others. When I did find out about my recurrence this summer, I actually reached out to some other Teal team members who are living well with recurrent disease, and it was very helpful for me. It can be emotional too, but I do find it healing. I also focus on what is true and not the what ifs. So when worry comes, and it will come, I ask myself, do I know this thing I'm worried about to be absolutely true right now, today? And if that answer is no, then I process it however I need to, whether it's to journal, to pray, to talk to a friend or a counselor, whatever's needed, and then I let it go. I do not allow myself to set up a tent and camp out in the worry and marinate in it, at least not for very long. If I catch myself doing that, I try really hard to stop. I do also try to take care of myself. So for me, that does mean trying to eat better, trying to eat a lower glycemic index diet. Didn't help this afternoon when I grabbed a handful of chocolate chips. I felt quite icky after. And that's a good thing that I did, because I should remember that next time I'm going to reach for that. But I do feel better when I eat well. And so I continue to work on that. It also means moving my body. I did try to stay active the first round through chemo. And then after chemo was done, I did what I could to try and follow some YouTube people and exercise regularly. I didn't really find that it was quite enough to get me strong enough to go back to work. But when it was time to go back to work, they put me through this rehabilitation gym program, and that helped a lot. Some cancer centers have some type of something available, but the waiting lists are long. So if your cancer center does have something like that, sign up early. Some health plans have athletic therapy or athletic training or physiotherapy. All those things help. And I do remember seeing a physiotherapist and taking my list of exercises to my TV area and working on those exercises while I was watching TV. I kind of got out of that habit, so I need to get back into it now that I've heard Dr. Rutledge talk about that. Makes it pretty easy. And sometimes the physios or the therapy or the exercises can be not super exciting, so it helps too. This time around, I'm even more intentional about trying to keep active, and I've been able to join a twice a week online exercise group for people with cancer, as well as what I do on my own. And I have a few more weeks of bike riding before the snow comes, and so I'm going to take advantage of that. And then when the snow does come, I will actually switch to something else. I also feel that I need to honor my feelings. Friends might think it's time to move on. I don't at the current moment, but I have kind of heard you have hair now, so you're fine, right? And I try to hear what they mean rather than what they say, if what they say is not helpful. Then later on, I'll debrief and work through whatever I have to. People, they don't know what they don't know, and they don't always know what to say. And so sometimes they don't necessarily say helpful things. I do have a support system, and I can go there when I need to. So it's okay if not everybody in my life gets it. Having said that, if I found myself in a toxic relationship that was detrimental for my health, I would have to decide if that was something I had to leave or deal with or get the support I needed to get through it. I spend time doing the things that I like to do. Whatever that means to each of us, it's important not to close ourselves off from everyone. Even if my counts are low and I'm prone to infection, I choose, hopefully wisely. So I really don't want to be in a crowded movie theater. That's not important to me. But I will still want to spend time with people in my life that I love. And I try and do it as wisely as possible. Maybe postponing a visit if somebody is sick, but otherwise still being with people. I don't always do all of these things well. I cannot control my diagnosis. I really can't even control my prognosis, but I can control my attitude. I control how I choose to live, how I choose to move my body, how I choose to eat, etc. I did actually kind of choose to exercise much more intently after I watched a Living with Cancer video talking about how important exercise was. And yes, I could lose a few pounds, but they even said, as you're working on that, exercise, even if you're overweight, is still super, super beneficial. So that has really inspired me on. So one thing I can choose is to continue to have hope. And so that's what I'm choosing. And I hope that each of you will choose that too.
Terry, that was awesome. Thank you so much for all of those great tips. Again, striking a chord with all of those. And I love the living with intention. Everything you do is now with intent. With intention. So thank you for sharing. Victoria?
Thank you.
And of course, I really don't have a lot to offer that Terry didn't say. She's got a lot of really fantastic advice. I do the same thing. I wake up every day with the intent to live well. Because that is the only thing that I can control. I can't control that I was diagnosed. I honestly don't believe that I can control my prognosis, but I do believe that I can put myself first. I do believe that I can give myself the best chance. And I do believe that I can live a life without regret. And I don't want to regret anything and say, well, what if I had taken more vitamins or eaten more garlic or had more kale? Maybe I wouldn't have cancer. And truth be told, I don't want to live like that. And I don't want to have those thoughts. So I get up every day knowing that I'm having this recurrence and knowing that, ovarian cancer is a often a grim diagnosis. It can be scary. There's a lot of scary facts and a lot of scary results out there. And I don't know how much time I have left on this world, be it 10 years or I'm on my 449th bonus day, I think is what I like to look at it as. And it's just a new version of me. And so waking up every day with intent to live well, to feel well, to be my best self, to make a good impression on someone, to make someone's day, to give them a smile, but also to give myself a smile. What feels good to me? I have recently left my job after 8 years because it wasn't what was good for me. I had feelings of being taken advantage of, and I was sitting too much, and I wasn't able to eat things that were healthy or go for walks with my kids or actually experience life. And so for me, big changes are coming in that regard because I've decided going forward that those are priorities for me. Seeing my family is a priority, being able to be with my animals is a priority, or being outside or learning a new skill. Those are all things that are important. And I'm not going to let cancer stop me from making those choices to better myself, because to me, that would be like admitting defeat. Yes, I'm going to go back to school and maybe I'll learn a new language, and I'm not going to think about how long I'm going to learn that language for. I'm going to treat it just like I would any other thing and tackle it head on like the battle axe. I know I am. Self-care too is really, really important. So I read a lot of books when I was first diagnosed. I was heartbroken. I didn't think I would get another day. And I got tired of crying myself to sleep. So I started doing a lot of good things for self-care. So yoga, and that's when I actually learned to crochet. I didn't know how to do it before that, but it helped with the neuropathy I was having from chemotherapy. And so now I'm doing that regularly. Journaling my feelings, I find really, really helps. I have been seeing my cancer care psychiatrist, or psychologist, which has been really great because it's someone to bounce ideas off of. And like Terry said too, the TLTs have probably made the biggest difference for me overall of anything. Just talking to someone who gets it, who knows what it's like to hear those words, to question your mortality, to worry about whether you're going to see the end of the year or the following year, to, have that scary night when you stayed up too late from crying and you hit Google and you see things that you probably shouldn't have seen. And I'm sure we've all been there, but they've been there too. And for me, that was instrumental in my feeling well and having hope and knowing that I can believe in myself and think that I can do better. I'm also a huge foodie. And so having to give up a lot of things that I loved, like chemotherapy, kicked my butt, to put it bluntly. I didn't have the kind of energy. I still don't. And I've been doing chemotherapy for quite a few months now. It's hard to cook well and live well and fuel your body with good, healthy food that tastes good, that isn't processed, when you have no energy. You're not sleeping, tossing and turning with neuropathy. It's really hard and tries to bring things sort of full circle when, you're not well to begin with. So I batch cook. That's kind of my secret. On Sunday, I made 8 dozen muffins with my daughter. So not only did we have some quality time together, but we made some healthy muffins. They have quinoa and kale. They have zucchini. There's fruits in there. They love them. It's a quick breakfast that they can take. It's a quick thing I can grab that tastes good, but is also healthy. And so I don't feel like I'm sacrificing. There is some chocolate chips in there. So, that helps. I'm big for everything in moderation, but batch cooking's been my secret to my sanity and to being able to eat well. In terms of exercise, that's always been a little more challenging for me. I'm very much a sedentary type person. So I found for me joining those exercise programs and meeting with my peers and doing it socially has been a really good way for me to keep that accountability. I wouldn't do it if not for that. But if I make the plans and I'm going to meet up with somebody or do the Excel program online or one of the exercise programs offered by Wellspring, that keeps your accountability there. And then you have a professional who's watching over, can help you with the symptoms that you might be experiencing after having a hysterectomy, or anything else that you might be going through. So doing it safely and keeping yourself well. And I found that once I was eating better and sleeping better, or eating better and exercising, I was actually sleeping better too. And that kind of everything, in full circle with my mental health. And so I think that's pretty much the only advice that I really have to offer, is just that nobody knows how much time anybody has. And I used to hate it when people would say that to me, but it's true. So live every day with happiness. What is going to bring you joy today? And how are you going to find that? And that's just how I'm going to do it for the rest of my days.
Thanks, Victoria. I bet your house smelled amazing on Sunday. And
Oh, yeah.
I love cooking with my kids too. And those are some of the best memories that they still bring forward. So great advice. I also had one question. What language would you learn?
Probably Japanese. My daughter, my daughter's currently learning Japanese and she wants to go to school there. So I took it in grade 12 back when I was in high school. And I think I'd like to go back into that too. But even changing my career at 42 is something that I'm really considering doing. And, you know, a lot of people might look at that and go, "What? But you have cancer, it's recurred. Like, what's the point of shelling out money to learn these skills or to take these courses?" And to that, I say, if I'm going to do that, to be blunt, what's the point then of continuing to go if I'm not treating my days like I have many more left? Let's do it. Let's give myself hope and promise every day, learn new skills, learn new tricks, sign up for something in 6 months. I'm going to be here. And with that belief, I think that I will. I think that mental health is a huge part of the battle.
Thanks, Victoria and Terry. And Rob, I mean, it's been an excellent presentation, and it's so nice to be able to hear the lived experiences and back up a lot of what you're saying, Rob. So thank you both so much for sharing. We do have some questions, so we have actually quite a few. So I'm going to get started on some of those questions. So Rob, this one is for you. You talked about a stand-up desk, I know, and there was a question in there. Does a yoga ball, like sitting on a yoga ball, does that have some of the same kind of benefits? I know, I guess you would use your core a lot more in using a yoga ball.
Yes, makes sense. So I just have to reflect, Victoria, Terry, thank you so much for speaking from the heart, and just like so much wisdom that I couldn't cover, you know, those aspects because I was kind of focused so narrowly, but it was so wonderful to hear that flush out of the big picture. So thank you so much for that. Yeah. So to answer the question, yeah. So when you're sitting on a yoga ball, you're having to balance yourself and, you know, use some of those muscles. So it's better than sitting on a solid chair. I would still want a person to stand up every, hour, even for a couple minutes type thing.
Okay, here's another one. Rob, I think for you as well. So with regards to the microbiomes, this person can only imagine what chemotherapy does to that.
Right.
So how can that be rebuilt, or how can we balance that?
Right. Yeah. So it actually does take time, but it does rebuild. It's remarkable that, the chemo is going to kill lots of bacteria, but it seems that if you go back to a diet, whatever diet that is, you'll replenish the bacteria with time. So there's lots of hope on that side. But there's also the hope that if you can add some more fiber and kind of decrease the processed food, you actually improve the kind of ecosystem and the different types of bugs there. So yeah, it's tough while you're going through it, but you can regenerate is the takeaway.
Great, thank you. Another one here. So after multiple cancer surgeries, with all major abdominal muscles having been severed repeatedly, how do we safely put in an exercise program in place? Especially weight-bearing exercises seem to be the best for bones and muscles. Any advice there?
Oh, well, I mean, it's pretty clear that people need to get expert advice, right? So you work with what they call a certified or a clinical exercise physiologist who has expertise working with people who had a cancer diagnosis. But there's all sorts of different ways to work with that. Even if the abdominal muscles aren't there, there are different exercises that people can do to actually get the cardiovascular, the strength, the coordination, like those happy hormones released from the muscles. So I talk to an expert is the takeaway from all that.
Yeah, great. Okay, so this goes back to the first half of the presentation. So how do you go about establishing a relationship with your oncologist if you have a team approach? This one is coming from Ottawa, but I know also in Manitoba, it's a team approach. You're not necessarily going to see one oncologist the entire time.
We do have a team of 6 here in Manitoba. You don't necessarily even know who you're going to get ahead of time. We also have a nurse practitioner who's fantastic. And sometimes you might talk to her too. For me, in terms of having a relationship with them, if that's something that's really, really important to you, you can ask them in your chart to see your primary care provider. I know for me and mine, there is a request of that nature, because that's what made me feel more comfortable. I like the continuity of seeing only a few people instead of a bunch of different faces. And when it can be truly life-changing, you need to have that trust relationship. So it's okay to ask. I know that some files will notate that as long as it doesn't interrupt important cycles in your treatment, such as like having to have an appointment after a few rounds of chemo or after a scan, they don't want to postpone that, but you can request.
Thanks, Victoria.
Yeah, excellent. I mean, sometimes it can be the nurse practitioner that you have the best relationship, right? Yeah, because the nurses are fantastic, really. Yeah, so.
We actually had a conversation with the nurse practitioner last week, the one who is in Winnipeg, and she said, yeah, she gets to see every patient and she gets to schedule an hour for each patient, not 5 minutes or not in and out. So you actually get some time. So make sure you know who's available for you to see as well.
It's incredible.
Yeah, and so the nurses are really smart, right? Because they know what their limits are. They know when to pull in the doc for the, that 5% question that they don't necessarily have all the information on. So you can trust the nurses that they will advocate for you and get the doc to talk to you if need be.
The other thing that's really helpful about talking to our nurse practitioner is she will come at a question with, there is a study that says this. So there's more teaching involved because she has more time. And I have asked questions of doctors and they've given me I'd rather you don't do this because, and I didn't necessarily always get a really good answer. But then when I asked my nurse practitioner, she came back with, there was a study and this is what it said. So with more understanding, I was able to feel like I could be more I was going to comply with what the doctor recommended, but I understood more. And so I was more prepared to be able to do that. So, and I have also requested to see my primary physician when possible. I know it's not always possible, but I've never had any doctors be rude or upset about the fact that I made that request. So it's definitely possible.
Thank you. Here's a question. How do I respond when my oncologist thinks I'm jumping too far ahead with treatment options for my second recurrence?
I mean, it's a good point, right? I guess, that could be the oncologist being paternalistic, going, you're creating all sorts of extra anxiety around what might happen in the future. And so maybe the oncologist saying, let's just live the day to day. The other thing I would say to put this within context is that, like, there are billions of dollars that are being pumped into the kind of research around these things. There are going to be breakthroughs in terms of therapies coming down the line. And if you recur, there may be a whole different type of therapy that's available at that point in time. The other thing is that there are clinical trials coming down the pipes and that you might qualify for a clinical trial at some point in the future. So I don't know, I guess I'm being a little bit paternalistic, saying let's just live in the moment and try to get the best care now and don't go into all the hypotheticals, because you'll probably drive yourself crazy with all those options. I know. What do the experts say?
Lots of head nodding there, Victoria.
I completely agree. I completely agree. I for one don't find it's healthy for me to look at too many of my options and to look too far into the future. I know that when I first met with my oncologist, she offered me the news and information in two different ways. She said, if you're the kind of person that wants statistics, let me know. If you're the kind of person who wants to take things day by day, let me know. And I chose the latter because that's just better for me. I don't want to think about what percentage live this long or do this or eat this or need this. That doesn't work for me. I'm not a statistic. And I found that I took it too internally and too literally within my body. So for me, it's all about my individual case and my individual needs.
Thanks, Victoria. Right, Rob, I see that there's another question on here, and I know that this may be a complete session in itself. So I'm just going to say it and then welcome you back to come and do another session. does the doctor have information on alternative and complementary therapies?
Yeah. Okay.
I know this is a huge topic and we have done sessions on it before. And I know there are some great therapies out there. I'll let you speak to that briefly, but like I said, we would love to have you come back
Yeah.
and do a session on this.
Yeah, I would be happy to. In fact, those were my next set of slides. Yeah, so yeah, there's so much to say that do your research, figure out the pros and cons of everything, let your medical team know what you're taking. I think we'll stop there. There's no kind of home run shark cartilage or STX that's, that people are missing out on. But it's another way to empower yourself and make sure you're doing everything that's right for you. So hats off to you. And I do look forward to offering that session at some later date to Ovarian Cancer Canada and Wellspring.
Great, thank you. We have done a session on it in the past for that person that asked. So you will find a recording on our website as well. So we do have a recording of that from last fall, I believe. So thank you.
There's the link coming up in the chat box.
Oh, perfect. Marianne is on it. Thank you, Marianne. So you guys, that's all the time we have. We're at an hour and a half, and I really want to thank you for taking time out of your night to share with us your expertise and your wisdom. And Victoria and Terry, I get a chance, please, to read through the comments and read through some of the chat. You have been inspirations to a lot of people on this call tonight, and we can't thank you enough for giving that of yourselves to everyone else. So thank you all. And I just wanted to, again, thank Wellspring and just tell everybody again how excited we are about these new programs. So the first one, again, is a peer-to-peer match program. You've heard both from Victoria and Terry tonight how powerful and impactful it is for them to be able to connect with other people living with the disease, to share experiences, to share hopes, and just to share fears and anxieties as well. So that peer-to-peer match program will be great opportunity for that, as well as a facilitated support group. So watch, there will be registrations coming out in the next couple of weeks. Terry and Victoria also talked a lot about the Teal Tea. So we run these sessions once per month. We actually have one next week on September the 27th. That runs at 1 p.m. Eastern time. You can register. I think Marianne's put the registration in the chat. And we also have one for young women living with ovarian cancer. That is on Wednesday, the 28th. And that one is at 6 p.m. Eastern. We have also an online chat. So if those times don't work for you, or if maybe you're not ready to meet in a group setting, Of Dialogue is an active and vibrant online community. So again, it allows you to ask questions, to read, to get advice, and just learn from other people's experiences. Now, finally, I feel like I've talked for a lot there, sorry. But finally, you know what, your feedback is so important for us, and it really helps us to shape these sessions for the future. We want to be able to provide the information that you want to hear about. So please take a few minutes. I know Marianne is going to put that in the chat also. You'll also receive an email link to that tomorrow, but please take a few minutes just to fill that out. Like I said, it really helps us to shape these sessions. So again, Rob, Victoria, Terry, thank you for sharing your evening with us. Judy, I want to thank Wellspring again for this fabulous partnership that's going to be coming to fruition here in the next couple of weeks. Thank you for joining us tonight, everyone, and have a wonderful evening. Bye-bye.
Thank you.
Real pleasure, Victoria, Terry, Stephanie, Judy, really appreciated this.